but most of it is not available locally. What we have achieved through both direct advice as well as preventive transfers, which I will show you in a second in terms of the cases we have dealt with, is we have saved lives, but we have also saved livelihoods. When you assume a patient from a village goes to a city, along with him, his family, his teachers, as well as all of his children, they all have to move. The boarding, lodging cost, everything goes up 7 to 10-fold. So just preventing one patient from not moving from their own home center is a huge economic advantage for them. The other things that we are actually looking at is, in terms of, if you look at the background, that we are having several screens. We actually see multiple patients. I'm going to try to share my screen here and show you a quick snapshot, quick check for video. You'll be seeing a kind of a collage of multiple patients that we see. Due to patient privacy, I'm not going to really show too many of that, but you can actually see plenty of the patients. I'm going to quickly run through a few cases so you can actually see what we're actually doing, and it'll be interesting for you to see the kind of patients that we've seen. Let me see if this works right here. This is actually our website, you can see that. I have mentioned that we have done some research, so just as a display here, you can see the articles that we have published. This is one which is our Apollo Medicine series. We also have another article about e-neurointensive care that we have published. And we also have an article in the Indian Journal of Critical Care Medicine. And what we are actually doing right now is that the patients that we've seen, the first patient is someone with a 32-year-old man with acute stroke. And what he really did was, this patient presented with what looked like weakness. He had fallen from a bike. But what our team did was to do the standard process of evaluating it. We in fact detected a stroke in a 32-year-old young man. We used tele-neurology advice, and we were able to actually guide the team at the remote site to treat the stroke and avoid a transfer. We had 24/7 availability of neurologists in our hospital, as well as subspecialists. Now, one of the biggest advantages, which is not seen in any other country, and I can say this with conviction because I do critical care for the US remotely, no other place can you get access to subspecialists 24/7, and we can do that with the Apollo system. Another patient that we saw was someone with a chest pain episode, and this patient, the ECG showed a very acute myocardial infarction, and cardiology is very dear to a chairman's heart, literally, and he will be pleased to know that we were able to diagnose the heart attack immediately. We had our cardiologist guide, and we were able to actually give thrombolysis to a patient located remotely. And once he stabilized, we transferred him for the advanced procedures, including catheterization. We are able to also rapidly recognize irregular heartbeats and things of that sort. Another patient we saw was a young man who in his village had a traumatic accident. He had multiple injuries, and we were able to guide the remote team because some of these patients cannot be shifted right away because they have multiple medical issues. And we were able to actually guide them in detecting lung collapse, detecting bleeding, and with the guidance of our trauma team here, we helped the patient actually stabilize that he could have definitive surgery. And lastly, I just want to share what our war, the war we are all fighting now, the COVID pandemic. Fortunately, because of the vision as well as, I really think it is critical care, and that's what ICU is all about. Critical care is really caring. And our system was able to establish links with the help of our various verticals with very remote PSU hospitals so that they can get world-class care wherever they are. We have, in fact, a 45th edition of our protocols for managing COVID, and we were able to guide these remote sites. In fact, we are taking care of about 15,000 COVID patients remotely from this center over the last year and a half. So we are able to watch oxygen levels. We are able to teach patients to do something called awake proning, where you lay on your stomach and your oxygen level actually improves. So I'm going to stop with that right now, but I'm going to try to see if I can quickly screen share and show you one other thing which I think you'll be very proud of. Let me see here. One second. So these are some of the articles our team has written. We are defining tele-critical care for India. And I really cannot thank Chairman enough for pushing us in this direction. This is an article on the Indian Journal of Critical Care Medicine from the critical care team in Chennai, and they wrote this article during the COVID crisis. There's another article that myself and a colleague wrote about tele-intensive care in COVID, and with the help of some of our senior as if we go to Ganapati, we evaluated our critical care from Apollo Hospital, Hyderabad, and we published this. There's a lot of data that is published, and I'm sure you're all aware of the huge inroads artificial intelligence is taking, and this is an area ripe for artificial intelligence. So, to summarize, telecritical care is going to save lives. I must thank Chairman, I must thank Dr. Hari Prasad, and of course Dr. Sangeeta Reddy, who's not able to be here today, but they have been the vision for us to kind of drive this forward as far as this is concerned. So we're going to try to share a video next, and I'm going to hand it back to Dr. Mahajan. And again, thank you so much for this opportunity to help us do what we do best.
Thank you, Dr. Sai Harnath. As you would have seen, that's such a brilliant example of what can be, is the art of possibility, what is possible and what can be achieved. And if we could summarize it all in the video, Saurabh, are we in position to share that, please?
At Apollo Hospitals, we harness the power of technology to work for people at every level of our care network to support both the caregivers and their patients, no matter where they are. With over 10,000 beds across 71 hospitals, Apollo Hospitals is India's largest integrated healthcare provider. And with approximately 2,500 critical care beds across India, we are the largest critical care providers in this part of the world. Apollo Hospitals have touched more than 150 million lives from 140 countries with a mission to touch 1 billion lives. Bringing in the much-needed change required in providing quality critical care and bridging the shortage of critical care beds, specialized doctors, and paramedical resources. Apollo Hospitals introduce modern and sophisticated critical care monitoring systems for anytime, anywhere care. Apollo eAccess. eAccess is our initiative to reach out to the remotest places to provide quality critical care services round the clock. This service is all set to usher in a new era of critical care management in the country. Our recent experience with COVID-19 surge strongly suggests that this is much needed in our country going forward. The eAccess initiative of Apollo Hospitals is a transformational electronic critical care and emergency program that combines audiovisual technology, data visualization, predictive analytics, smart proactive alerts, and advanced reporting capabilities that are delivered by Apollo emergency and critical care experts. Apart from providing the much-needed critical care solutions, Apollo eAccess looks at the building competency of partner organizations by imparting evidence-based upskill programs. eAccess provides remote critical care monitoring service solutions to our partner organizations to equip them with trained intensivists round-the-clock, access to proven clinical protocols, and has the capability of connecting over 1,000 multi-specialty clinical teams of our hospitals. eAccess is a hub and spoke model. After the success of this model in Hyderabad Hub, we have begun an ambitious program of developing a network of hubs and spokes across India. We believe innovation is an attitude far from being merely skill, and at Apollo, we epitomize this truth. eAccess, empowered by technology, empowered to save lives.
Thank you very much indeed for summarizing where we are with regards to, and our vision with regards to critical care networks and expansion within India and beyond. So this is, I think, the right juncture in the program to bring in our international guests today to see what they think, where we are, and how can we go further. So I'm very pleased to see Mike Swart has joined us. Mike, thank you for joining us. It's quite early morning for you in the UK. Mike is critical care specialist consultant critical care in Torbay, but his main contribution to the UK medicine has been in form of as a council member of Royal College of Anaesthetists, but he has been a leading figure in getting it right first time, quality improvement program, and defining how can you get it right first time if you are a perioperative physician. And that is now a nationally rolling program which is helping out people in the UK getting to grips with the backlog of the surgical care. So Mike, here you are, your comments, your reflections of what you see.
Thank you very much, Ravi, for inviting me to listen in and to contribute to this. It's very exciting. I'm not sure this is going to work, but I'll try. As I've been listening to this is what I'm seeing. I don't know if that all worked, but it was the sun coming up. And this for me sounds like, or feels like, a new dawn of critical care. My initial thoughts, COVID-19 has exposed all of us to the inadequacies of our healthcare systems. Critical care sets a very high standard, but has very low access. What you're doing in India with Apollo, we need to replicate in the UK. We all need to improve training, to improve research, to work in a multidisciplinary way to provide better care or better access of care. This is very exciting. Thank you again for letting me join you.
Right, with that accolade, thank you very much indeed. And I'm sure, as you would have seen, there would be needs for further collaborations on many fronts. And this is only the beginning, but thank you for being here. I know it's early morning for you, and I know you will get ready and go to hospital. So if you feel like leaving at any stage, that will be fine, Mike. Thank you very much indeed. We have another guest, and she is from US, Dr. Kalpalata Kuntupalli. She could not be with us physically today, but she sent some warm messages which Dr. Haranath is going to present. Dr. Haranath.
Hi, thanks. So Dr. Kalpalata, as you all know, is the former president of the American College of Chest Physicians. She has led critical care fellowship for almost 40 years. Several of her fellows are all over the US and the world, and she has a fond attachment to India, and every year she has been serving people. I spoke to her and she was extremely happy. She was, she's probably sleeping right now, but this is what she said. I'm very pleased to learn about the inauguration of the Apollo Center of Excellence in Critical Care. As a physician of Indian origin who migrated to the US in 1974 and has kept in regular touch with both systems of practice, I can emphatically say how important this initiative is. Practicing critical care is much like flying, managing a complex system that requires state-of-the-art equipment, methodical approach that is standardized and protocolized to maximize the return of health and minimize errors. This initiative of Apollo therefore comes at the most challenging time of the century, the COVID pandemic, having witnessed what can be the worst and best in medical care during this pandemic. I promise my fullest cooperation is needed to see the center excel. I have first-hand experience of the excellence in critical care provided in the Apollo facilities when I took care of a patient for 3 weeks in 1999. I have much admiration for the vision of Dr. Pratap Reddy Garu and the leadership of Ms. Samita Reddy. So I think she really wanted to join, and I'm sure this is honestly just the beginning. We have a long way to go, and there are multiple things that the world can help India, and we can help the world from above.
Thank you very much, Sai, for presenting Dr. Kuntupalli's her comments and her good wishes. Again, we will look forward to collaborations. And now it's my pleasant duty to invite Dr. Alison Pittard. Dr. Alison Pittard is currently Dean of Faculty of Intensive Care Medicine in the UK, and this is faculty of 4 medical Royal Colleges. Dr. Alison Pittard is a clinician, of course, in critical care, and works in Leeds, not very far from where I started my career in the UK. But Dr. Alison Pittard has been so dedicated during the pandemic that Queen decided to award her with OBE, which she received very recently, and that is for her services to critical care nationally and internationally, especially during the COVID period. It's a real pleasure to have you here, Alison, and I would like to hear, or we would like to hear, what do you think?
Thank you, Ravi, and it is my great pleasure to be here to help celebrate the launch of Apollo's Centre for Excellence. What I've heard so far and from what you have told me, Ravi, it's an incredible thing to be doing. And I think the pandemic has given us the opportunity to reflect on how we deliver all healthcare, but specifically critical care. There are inequities around the world, and we know that there are health inequalities, and we're all trying to address that in various ways. But we need to ensure that there is equity of access to healthcare services around our own countries and globally as well. And I think one of the things we need to make sure is that we get the basics right. And the pandemic has showed us that when we first started almost 2 years ago with COVID, we didn't know what we were dealing with, so we weren't able to deliver any specific treatment. So we had to get the basics right. And I think Apollo's approach, the hub and spoke model, is where we need to get, because we can upskill people, we can train people with the basic skills to be able to roll out the delivery of care on a widespread level, so that everybody has access to what they need, when they need it, and where they need it the most, so they can be close to home, as we've already heard, because the economical consequences of people having to travel to get their health care. The telemedicine that we've just seen is